Hello and welcome to Family Forum. My name is Kim Gordy. I'm a social worker at the Town of Groton Human Services. I will be your host for the next half hour or so, and in this Family Forum segment, we will be showcasing Ledgelight Health District. As you may have seen, on our last Family Forum, we discussed substance use disorder. We discussed the use of Narcan, and we talked with the staff of New London County Cares. Today we will continue that conversation. We will dive a little bit deeper into this very important subject. Ledgelight Health District is the local health department for Groton and a number of surrounding towns. In addition to a multitude of other public health services, Ledgelight and partner agencies, including Alliance for Living, work to implement the New London Coordinated Access Resources, Engagement and Support, or NLC Cares project, which provides support for individuals living with substance use disorder. They work across agencies to improve conditions that contribute to overdose, and they raise awareness to the overdose crisis and the ways that community members and partners can help to prevent overdose. I would like to introduce our guests for today. Today we welcome Jen and Margaret to Family Forum. Jennifer Muggeo is the Deputy Director of Ledgelight Health District, where she has worked since 2005. She coordinates both administrative and financial programming of Ledgelight and also works with community partners to coordinate efforts to address prioritized health concerns, including the overdose crisis. And this is Margaret. Margaret Lancaster is a health program coordinator and peer navigator community health worker at Ledgelight Health District. She has worked there since 2020. She's a lifelong resident of New London, and she has many ties to agencies and to the community. She is a person with lived experience, and she has committed herself to supporting and speaking on behalf of people who have not found their voice to speak to the disparities that so many face due to oppression, due to systematic barriers, due to racial injustice, as well as healthcare inequalities. It is a pleasure to have you both at Family Forum. Welcome.
Thank you. Thank you.
So just to start things off, I'd like to just kind of frame the conversation and just talk a little bit about what are we talking about when we say opioids, and what are we talking about when we discuss opioid overdoses?
Well, opioids are a group of medications or pain-relieving drugs that can be prescribed, or they can be non-prescribed, or a drug that is purchased that's in the community. One thing I can say about opioids, the way they react to the body is through the receptors, and they're pain relievers. We know that some prescribed medications are pain relievers, so some of those in the category of opioids would be Vicodin, oxycodone, morphine, Percocet. We know that there's hydrocodone, and we also know one that we speak of highly now is fentanyl. Mm-hmm. And then we can talk to the heroin that has been, at one point in our communities, more used, less now, but more prevalent now we have found, it's fentanyl. And what is an overdose? An overdose is the use of an opioid or overuse of an opioid, which becomes life-threatening and causes someone to either be revived through Narcan, which you talked on in the last show, or naloxone, or it can be fatal.
One of the things that opioids do when they're sitting on our brain receptors is to send a signal to slow or stop our breathing, if there's too much of the opioid sitting on the receptor. That's not to say that happens every time. There are, as Margaret mentioned, pain relieving benefits to an appropriate dose of an opioid, but when somebody is experiencing an overdose, there's more of the opioid sitting on the receptor than the body can handle, and that signal to slow or stop breathing is getting very strong and resulting in the need for the opioid to be removed from the receptor through the administration of naloxone and sometimes through assisted ventilation.
Okay, thank you for that. and we'll talk a little bit more about naloxone later in the program. Can you talk a little bit about what factors contribute to overdose?
Two things I will say is tolerance and abstinence. We find that a lot of individuals that are either come out of carceral settings or jails, and coming out of detox, there's a high risk there, and using substances again, because there's the tolerance level has changed. There's a high rate of overdose that takes place with that, and using safer use matters. That's what we use, and the language we use, because going slow and not using substance as you would, not understanding what the tolerance is, and again with fentanyl being right now primarily the substance that's been out and being used as an opioid in our communities and causing more overdoses than heroin did. Not that the heroin doesn't, but fentanyl has been one that has really overtaken the use of substances in our communities. That's where we have to give more education around, the tolerance and how, if abstinence has taken place, how to get connected with the resources that will assist. And we can do that through the resources that we'll talk about later, in that way.
And just to dive into these concepts a little more, because these are words that may not be familiar to folks at home, the idea of tolerance is actually our body's real biological response to consuming opioids. So opioids are a class of drugs for which we quickly build up a tolerance, and that's why if anybody knows anybody who's had experience with being on opioid pain relievers for some time or using illicit substances, illicit opioids, they may kind of reflect on the fact that what they used to take isn't bringing them the same level of pain relief, and they're looking for their dose to go up if it's a prescription. Our bodies develop a tolerance to the opioid, and it takes a little bit more or a little bit higher dose for us to get that pain relief that we once got from the lower dose. It can serve as a bit of a protective factor if we've got a tolerance built up and then we consume an opioid. If person A has built up a tolerance and person B hasn't, person A and person B may take the same amount of an opioid but have different outcomes because of their tolerance. What happens when somebody goes through a period of abstinence from consuming opioids, which happens in a number of different settings and ways? Someone may be incarcerated and not have access to the drugs they were using before. Someone may choose to go into detox and an abstinence-based treatment program, and that means that they are stopping all consumption of opioids, right? That's what we mean when we use the word abstinence there. The tolerance that they very quickly built up before also very quickly diminishes. Unfortunately, if that person does have substance use disorder or opioid use disorder, the symptoms of the disorder haven't gone away. And so they, at some point following the period of abstinence, it is very likely, based on what we know from decades of following the data and from talking with so many people in the community, it's very likely that they're going to experience those cravings, those drives to consume opioids again. Unfortunately now, their tolerance has dissipated quite a bit. And so they face a higher risk of overdose coming out of those settings because of the tolerance being down, and then also because of not really knowing what they're consuming, which is a really big contributing factor to our overdose crisis. The kind of wave, when we talk about the waves of the crisis and we talk about the initial focus on the misuse of prescription pharmaceuticals more than a decade ago, and then we talked about, we had this wave of heroin, and now we have fentanyl that has kind of overtaken the heroin supply. The supply, because it's unregulated, it's not checked by anybody, and nobody really knows what they're consuming. So I may not be intentionally taking more fentanyl than I took the day before, but I may risk overdose because I don't know actually what the mix is of the product in that bag. We also have a number of other contaminants in our drug supply, some of which are still opioids, and so will respond to naloxone, and that can help reverse an overdose, and some of which are not. And so we have to understand that there's a number of kind of intersecting factors here that are contributing to our ongoing crisis.
So you touched a little bit on the local impact of overdose in our community. Can you talk a little bit about what trends we might be seeing in terms of how overdose is affecting the local community?
Sure, and before we talk of anything about numbers, we just really want to take a moment to acknowledge that it's important for us to follow the numbers, it's important for us to understand the trends, because that does inform our efforts, it helps guide our interventions and our outreach. And at the same time, you know, these are people in our community.
Absolutely.
And all of the numbers that we look at on our reports were someone that mattered in our community. And we honor them, and we honor the loss to our community and to their family and friends, and you know, recommit ourselves to our ongoing efforts to prevent overdoses.
And can I just add
Yeah,
that,
go
you
ahead.
know, that substance use disorder is a diagnosis, not a moral failure. And that's what we also try to make sure that, you know, that's one thing we need to get out to the community, trying to normalize the diagnosis based on any other diagnosis someone has as a medical condition. And
Yeah.
that's one of the other things that we really try to emphasize, and that's one of the things we try to get out to the community, so we can have community input and community efforts to help us in this this time with the overdose epidemic that we're going through.
And it's a diagnosis, and it's not the whole of a person.
Absolutely.
So when we talk about people we've lost to overdose, you know, we honor their whole selves. So Groton, within the town of Groton, there are on average, you know, most years about 7 to 8 people lost to overdose. We've had a few years where that number has spiked up to 13 or 14. We've had 7 deaths so far this year within Groton, and obviously the year is not over yet. Those numbers are reflective of one town in our region, and like we've seen across Connecticut and across the country, the overdoses over the last few years have continued to climb within Ledgely Health District's jurisdiction. We also want to acknowledge that the numbers that come out from the Office of the Chief Medical Examiner are, of course, reflective of those people who did die from overdose. There are many, many more people who have survived an overdose. And it's an important message for us to get out there, first of all, to lift up those stories, to connect with those community members, to understand from them how we might better support others in the community, and also to provide some hope and a reminder that recognizing the signs and symptoms of overdose, what it looks like when somebody's experiencing overdose, and quickly responding by calling 911 and administering naloxone really can save a life.
Absolutely. Thank you for that. And how can people support their friends, their family members, their neighbors, fellow community members if they might be struggling with substance use disorder?
Well, I think, you know, stigma and shame are one of the 2 leading causes for individuals not to get help for themselves in any way, shape, or form, or reach out. So that being said, stigma and shame is what we ask the community to kind of look at, take away the stigma, so individuals don't feel shamed, so they can reach out to their family members and to individuals in the community that can assist them in any resources that they need. We say, you know, we use harm reduction approaches to assisting individuals in our community. My peers in the community, that's how we meet people where they are. And if the need is just something as simple as a pair of socks or some food, we start there. It's about relationship building. It's about connection. It's about not being outcasts. You know, it's about being connected, being part of, because they still are part of the community. And we want to be able to assist them and bring them in, you know, invite them to the table, you know, and have them join us, and we can be part of their life, and they can be part of ours at the same time.
Yeah.
And, you know, we reach out to the community and giving families the support that they need. You know, as we mentioned that, you know, this doesn't just affect one person. When substance use disorder, it affects the whole family. And families get shamed and they feel stigma because it's their loved one. And we don't want that to be a piece that they miss out on the opportunity to even be able to interact with their own family member who may be using substances and may need the support. And then we can engage with them to maybe be that intricate piece that gets them to the next place that that individual chooses to be.
One of the things that we think is really important when we're talking with families is to help them kind of dismantle some of the old frames and old ways of thinking they might have heard about. It can be very, very challenging, and we acknowledge that this isn't easy for anybody, right? And it is important when you're supporting someone in your family who is struggling with substance use disorder, you know, the idea that you need to take care of yourself, you need to protect your own self and your boundaries, but also some of the old thinking that we've heard over and over again about tough love and, you know, insisting that, you know, laying down the law that if you're going to stay under my roof, you've got to go to a meeting every day and you've got to do this and you've got to do that. You know, unfortunately, there's a lot of evidence to show that those ways of engaging with our family members are not likely to be successful and can, in fact, kind of further the divide and the impulse of the person to hide their use, which puts them at heightened risk for overdose, because you can't respond to an overdose if you don't know it's happening, if you aren't aware of the possibility. You know, so helping family members to understand what harm reduction could look like for them, and how we can take care of ourselves and still be there for our loved ones. Helping people to understand that there is a great deal of evidence to show that for many, many people, medication for opioid use disorder and also for alcohol use disorder can be really effective in managing those symptoms. And a lot of people have a misunderstanding of what it means to be on medication for substance use disorder, and that it's not, you know, really achieving that level of wellness. When if the symptoms of the disorder, if the person is meeting their individual health goals and achieved a higher level of stability, and their use is not continuing to disrupt their lives, then really we've, you know, made everyone a lot safer. So, you know, we encourage family members to reach out, to understand about medication, to think about how we can partner with them to help them support their loved ones.
Yeah, absolutely. That's helpful. Thank you for that information. I'm wondering if you could just speak a little bit to the specific services that you provide and what community members might know about the services.
Well, we have the NLC Cares, and we have the peer navigators that are out in the community. And those services are basically through southeastern Connecticut, from New London all the way to Rhode Island border, as in Stonington, and as far as Norwich. And they are available through the NLC Cares number. And they provide, you know, meeting people where they're at. It's a harm reduction approach to meeting individuals' needs that are specific to what the individual requires and asks for. And again, like it could be one day it could be, yes, today I just need food, but maybe there's an opportunity for them to get connected to a prescriber that can help them get on some medication for opioid use disorder, or it could be going possibly to a detox if that's what they're choosing, or going to treatment. Anything in between. It could be a ride to the doctor's office. It could be just a primary care appointment or a mental health appointment, but it's that relationship building is what we strive on, making sure they're connected with someone that can assist them at any given time and what their need is can be met. And the resources come through NLC Cares, which is collaboration through Alliance for Living and also the City of London and Leslie Health District.
Thank you. And one thing that folks may not know is you can provide Narcan and you can provide things like fentanyl strips to the community and to agencies.
Yeah, so we have a supply of naloxone for community distribution. We also have access points, one at our office in New London, 2 in Waterford right now, working on additional access points throughout the region, which are actually boxes mounted outside, and people can come up and get a box of naloxone if they can't meet with us during business hours or are hesitant to have that conversation because, as Margaret mentioned, you know, shame and stigma really are still big contributing factors for a lot of people. Another tool that we have are things called fentanyl test strips, and they can be used to test whether a product has fentanyl in it or not. We pretty much know these days that our heroin supply locally is likely to have fentanyl, but what's happening is that fentanyl is, through accidental cross-contamination, also showing up in the supply of other non-opioids like cocaine. And so it's particularly risky for folks who are not regular opioid users. They are more likely to be using stimulants to consume cocaine that has been contaminated with fentanyl because they haven't developed that tolerance we talked about earlier. So the fentanyl test strips can help them make a more informed decision about consumption.
Okay, thank you for that. Is there anything else you'd like to say about your services? Any upcoming events that you might have? Anything else you would like folks to know that's available?
Well, we do Narcan training for the community. As Jen has mentioned, we actually have gone out to businesses and restaurants, and they've been very receptive to getting the Narcan training, churches as well. So that's one thing we do. Family members, we have trained children of parents who use substances because there's a need for that. Anyone can learn how to use Narcan or naloxone. And it's administered through actually an intranasal spray. So, you know, if you give us, reach out to us, and at any given time, we can try to make an appointment for a community member or an organization to have Narcan training.
Wonderful. That's great to know. Thank you, Jen and Margaret, for being on the show. We want to thank you for spending time with us at Family Forum and the very important information for our community. And thank you everybody for watching. If you would like more information or support, please call NLC Cares at 860-333-3494. That's 333-3494. Thank you everybody.